Hey guys, welcome back to my channel. My name is Jessica Ward King, also known as the StigmaCrusher. And here at this channel, we deal with issues of mental health and mental illness from my twin perspectives as a person with bipolar II disorder, as well as a person with a PhD in experimental psychology. Does that sound like your jam? We would love to have you. Go ahead and hit that subscribe button, and if you want to be notified every single week when I post, hit the notifications bell as well. Remember to like and to comment and share widely. And with that, I guess it is time to start stigma crushing for this week. So folks, today we are talking about a bit of a potentially difficult concept. We are going to talk about electroconvulsive therapy. Now, how, you may ask, did they even get to this electroconvulsive therapy? Let's trace our way there. So one thing that psychiatrists early on noted was that folks who had seizures from natural causes woke up feeling better. They were less agitated, less irritated, and just in general, they were coping better. Well, psychiatrists obviously thought to themselves, if a seizure can do that, we need to try this on more patients, and more patients just than those that will just naturally have a seizure. So they started to think about ways they could cause a seizure in a patient. And one of the ways is through medications. And there are a variety of medications that can cause a seizure. So one of the things that they tried was a medication called metrazole. Metrazole did indeed form a seizure in the patient. And it was shown that after that therapy, the patient was, again, calmer, much more easy to deal with in the hospital. But in general, they did seem to be better. The problems with metrazole was, well, for one thing, they caused such violent seizures, actual seizure-induced, muscle activity, that the patient would very often have some broken bones, possibly even in the spine, as a result of the treatment. And because the treatment had to be done more than one time, in fact several times, this was a significant problem. Another condition that happened here was that folks that were being treated would start to feel impending doom after the medication was given, which didn't help in terms of patients that were, for example, psychotic or having thoughts that weren't rational. To be feeling like impending doom with this treatment didn't make them want to have it, let's put it that way. And they remembered after the seizure as well, which made them not want to have it in future. So the next thing they turned to, psychiatrists in general turned to, was how can we maybe use another, not a medication form, but another form of causing a seizure. And this was all brought out when a psychiatrist named Ugo Serletti went to his butcher's. Yes, you've heard correctly, went to his butcher. And the butcher was excited to tell him about this great new thing he thought of, and took him to the back and showed him a pig that was in need of slaughtering. Now, they slaughtered the pig by using a knife to the throat. And as you can imagine, pigs didn't much like this. And they would cause trouble, and it was difficult to get them to butcher. But if they passed an electrical current through the pig's skin on the head, then the pig was calm, didn't mind walking to the slaughter and ultimately being slaughtered. It made it much easier for the butcher to do his job and to get the meat. And luckily made it much easier for the pig as well. And so what Serletti took from this was an idea. Maybe if I pass electrical current through the skin on the head, eventually ideally to get to the brain, then adult humans would have a similar effect of calm, of feeling better, hopefully. And so he tried it, and sure enough, a bit of electrical current to the scalp of the head can cause unimaginable, before aforementioned unimaginable treatment and a success in a lot of human patients. Now, ECT is this electroconvulsive therapy. So caused by electricity, convulsive, causing a seizure, convulsions, and therapy. And there are some amazing benefits to this therapy. The treatment causes very rapid improvements. So whereas with medication, you can often start on a small dose, titrate up after a week, several weeks later, titrate up again, etc., etc., etc. This treatment could be done maybe 0 to 10 times. On average, around 6 treatments would cause an immense benefit to the patient. Even the most severe symptoms can be treated by this method. So we're talking severe depression, treatment-resistant depression. So you've tried medications, you've tried other treatments, nothing's working. This can. Severe mania as well is well treated by this method, which is absolutely amazing. Treatments for mania do take some time to have effect and are very difficult to treat. Catatonia as well, so that can be a feature of depression or sometimes of schizophrenia, where the patient won't move. It'll get into postures and won't move, won't eat, won't do all of the things that are required. Aggression, particularly in dementia, is treated very well with ECT. And this one amazes me, I mean, as a woman, but also, kind of as someone who is interested in this. Women who are pregnant or breastfeeding, who are often it's very much not recommended, not allowed, so to say, for those patients to be taking a lot of the medications that we prescribe for mental illness. And these patients that are pregnant or breastfeeding who have severe illness would have otherwise had no recourse, no course of treatment for them. And this electroconvulsive therapy can be very safely used in pregnancy and in breastfeeding women without any danger to the unborn fetus. And so that one amazes me and, brings me joy every time I think of it, to be honest with you. Another group of patients that is often really well treated with this is older adults it's very difficult to treat with medications, but ECT works extremely well. There are, of course, some side effects to the treatment. One of the big ones that you'll hear about most often is memory loss. So it almost always will cause memory loss when you're in a large number of treatments. So as I mentioned, quite often the treatments go about 10 to even 12 treatments of ECT, and they'll happen every other day or twice a week, depending on the protocol of the hospital that you're at. And so memory loss does usually result, and that can look like some retrograde memory loss. So for before the treatment happened, for anywhere, a couple of days, a couple of weeks, to anterograde memory loss, which is for after the treatment happens, where, you won't remember several days or several weeks into the future. It'll be difficult to remember what happened during those days. Another side effect that will happen is confusion. This is another one that happens very, very frequently, if not always. So having a treatment will cause the patient to have confusion, and maybe confusion for, excuse me, a few days hence. And so that can be difficult when you've got kind of a really pushed together block of treatments. It can seem like the confusion is lasting. There can also be muscle ache. So even though you are going to be having, for this treatment, you will be having anesthetic as well as a muscle relaxant, you can still have some of those muscle results from the seizure that you'll have, and have some muscle pain. Nausea and headache are also things that tend to happen. I know with myself, I struggle with chronic migraines, and every single treatment would cause me to have a migraine. So that can be a significant downfall for some folks. But generally speaking, ECT tends to be well tolerated. Here's the big problem with ECT, I think. And it's that it's really, it's not invasive, but it seems extreme. To the imagination, it's really quite an extreme treatment. And yet we have no idea how it works. None. We are still at the point of, ooh, look at the pig. The pig feels better afterwards. We have no idea how it works. And while studies are happening every day, we will eventually figure it out, for the moment, we are doing a treatment where we pass an electrical pulse through the brain of human patients so that they feel better. And they do feel better. But is that really the point? But let's have a look quickly at how it's done. The thing is that it is not as you imagine. It is not like it is in One Flew Over the Cuckoo's Nest, where they strap you down and you're wide awake when they pass the electrical pulse through your brain. That's not how it goes down these days. So first of all, as I mentioned, you're given an anesthetic. So you get an IV, you're given an anesthetic and a muscle relaxant. And you just kind of gradually drift away to sleep before any of the treatment happens. So you're already asleep, and anesthetic tends to cause some amnesia as well. Generally speaking, patients wake up and are like, did it happen? And they don't have memories of some kind of horrible procedure like in One Flew Over the Cuckoo's Nest. You can do this treatment either bilaterally or unilaterally. What does that mean? Bilaterally on both sides of the head. So that means the electrical pulse passes through both sides of the brain, or unilaterally, only on one side of the brain. The reason this matters is that there are some parts of our cognition that happen mostly or only in one side of the brain. And the really important one here that tends to make the difference to most folks is language. Language in people who are, generally speaking, right-handed, the language function tends to be in the left-hand side of the brain. And so when they asked me, do you want bilateral or unilateral? Here are the risks, here are the benefits. And one of the risks was, if you take it bilaterally and the electricity goes through both sides, you might have some trouble with your language for a little while afterwards. As a PhD student at that point, I was not going to risk my language faculties. And so for myself, I took unilateral. It tends to be more common these days to have unilateral, but there are definitely clinical reasons why you would want to have bilateral. You will not feel anything. You will just go to sleep. I mentioned that before, but I wanted to mention it again. It is not barbaric. It is quite elegant, the entire procedure. It is also an outpatient procedure. You do not need to be a patient in a psychiatric hospital who is residing there. For a lot of patients, they go into the outpatient clinic. They're taken in, the treatment is performed, they're given some time to recover in the recovery room, and then they're accompanied out by whomever is accompanying them, family or friend. It is, as I mentioned, a total of 6 to 12 treatments at a time. Sometimes maintenance procedures are done, so if you've had a good response to the treatment, but then you've relapsed, it can often work really well to have 1 or 2 treatments per month, per 2 months, whatever works for you, and that can really, it maintains your gains, basically. So it maintains the treatment and its effects on your mental illness. So my lived experience of ECT, I actually had 2 different courses of ECT treatments. So the first time I was severely suicidal, unipolar depression, I was at risk, and what I ended up with was unilateral ECT as an outpatient at a local hospital. And the kind of biggest outcomes for me, I did get better. So after about 6 treatments, I started to feel better. I did a full 12-course treatment, so it was 3 times a week, and it did work. It did make me feel better. Unfortunately, I had some more significant amnesia than we'd hoped. Part of the whole reason of doing the ECT when we did, I was committed to trying to figure out how to do it with medications. I was afraid of the ECT. But I was due to be married 4 weeks after the last treatment of ECT. And so we were hoping that they could get me better so that I could be better for my wedding. And it worked. I was better for my wedding. Unfortunately, I have no memory of my wedding. The anterograde amnesia, so the amnesia that goes forward from the end of the treatment, lasted that long. And while I can see the pictures and appreciate the smile on my face, I can't recall a single thing. Now, that's just unfortunate timing, unfortunate planning, perhaps. And just so you know, the wedding couldn't be pushed any further. There were complications of citizenship that were at hand. But in any case, it did do what it said it was going to do, but it caused me some significant memory effects. The second time I had ECT was about 3 years later, and I had relapsed maybe a year and a half after the first course. And so I was now at the point of very severe depression with risk to my life. I had been diagnosed with bipolar disorder at that point as well, so that was kind of going on. And things that happened to me, well, again, and I mentioned this earlier, severe migraine every time I had a treatment, which, kind of sucks, but you can take a pill and hopefully get better from that. But again, I had severe memory effects, and actually they're memory effects that have lasted to today, this long. And so I will find that I can read a book, for example, and read it again and not know that I have read it previously until I discover a handwritten note in the, on the 500th page. And so from that we can see that I'm not retaining some information, and it's not just books. I don't retain autobiographical information. So times that I have with my family, for example, they'll mention it several weeks later, and I will swear up, down, and backwards that I was not there. I've learned not to swear up, down, and backwards now because they're going to be right. But it's really it's saddening and disconcerting, and it makes me regret, to a certain extent, doing that course of treatment. Now, it did work, and I was no longer suicidally depressed, and so maybe it saved my life. In fact, I think it did. So the question has to be, would I do it again? And my initial answer is no. It's caused too much damage. I'm too regretful of having done it in the first place. I would never do it again. But then I think that you don't do ECT because it's a good time or because it's an easy treatment. You do ECT because you're in a severe state, and it is what will work fast enough to save you, keep you alive. And so I look at my son and my wife, and you ask me, would I do it again? And I guess the answer has to be yes. Because if it bothers me afterwards that my memory is damaged, at least I got to afterwards. And while I may not remember all of the good times that I'll have, at least I'll get the chance to have the good times. So I suppose for me, yes, I would do it again, as much as I want to say no. But all in all, I would recommend ECT to the folks for whom it's going to be effective, because it is effective. And I think those are my thoughts. I would love to hear your thoughts down below. Folks that have had ECT or loved ones, family members that have accompanied folks on their ECT journey. I'd love to hear from you what it was like for you. Did you have that memory effect that I've had? Would you do it again? And for those of you who haven't had the opportunity to experience ECT, what are you thinking of it now that you've heard this? Did it change your perspective at all? I would, again, love to hear from you down below. I will always respond. All right, well, take care and have a great week, everyone, and I will see you next week. Bye.
StigmaCrusher.